a couple of minutes. I would like to start with our land acknowledgement for this session. And because we are participating from all parts of the province, we do want to acknowledge that Interwoven recognizes that its work and the work of its community partners takes place on traditional territories across the province, traditional Indigenous territories across the province. And we acknowledge that there are 46 treaties and other agreements that cover the territory now called Ontario. We're thankful to be able to work and live in these territories, and thankful to the First Nations, Métis, and Inuit people who have cared for these territories and who continue to contribute to the strength of Ontario. I also want to acknowledge on behalf of Interwoven that the original stewards of the lands from which I am broadcasting from here in Toronto, as residents and employees in the traditional and treaty territory of the Mississaugas of the Credit, the Mississauga, the Anishinaabe, we also acknowledge that this area has been home to the Chippewa, the Haudenosaunee, and the Wendat peoples and their ancestors. So I invite everyone on the call to settle in. I know I'm going to try to settle in. And as you are settling in, I would like to introduce our panelists for today. My name is Rodola Saguma. I am a peer connector with Interwoven, but I would like to introduce to you Dr. Angela Geddes, who is a dedicated social worker and therapist with over 25 years of experience in supporting individuals with complex mental health and developmental issues, and particularly those related to prenatal alcohol exposure and fetal alcohol spectrum disorder. Her work focuses on providing holistic support, advocacy, assessment, and direct support for individuals and families. Dr. Geddes is also an author, having written a book titled A Complicated and Beautiful Brain to help deepen understanding of FASD and its impacts across the lifespan. She remains committed to reducing stigma and improving the understanding and support for individuals with complex needs. So good morning, Dr. Angela. And our other panelist today, we know very well, Dr. Maud Champagne. She brings to us extensive clinical research and personal experiences. She's the mother of 5 children through birth and adoption, and her now teenagers were older adoptees when they came together as a family. Maud has a PhD in neurosciences from Queen's University with a specialty in fetal alcohol spectrum disorder, trauma, and aggression toward family caregivers in childhood and adolescence. She is also a registered social worker and psychotherapist, and completed her MSW with a thesis on the experiences of parents raising children with FASD and developmental trauma while undergoing dyadic developmental psychotherapy. In the past, Maud has closely been involved with the implementation of the FASD Key Worker program in Vancouver and the FASD Worker program in Ottawa. She is a sought-after expert and bilingual speaker for related trainings and conferences with a passion for sharing ideas, strategies, and resources that support families. So welcome, Maud and Dr. Angela. And there is also one more slide that I would like to draw your attention to. It is our slide on mission and values. If we could, thank you so much. So as an organization, we have grown exponentially over the last year, and I am a product of that growth. So we want to hold true and continue to hold true to our mission and vision, which is to provide education, advocacy, and community to the myriad of families connected by adoption, kinship, and customary care, as well as those at risk of breakdown because of complex needs, and the professionals as well that support them and us. We envision a future where every family is equitable and has equitable access to mindful supports, resources, and community. By breaking down the isolation and supporting vulnerable families in need of innovative parenting approaches, we enable family preservation and well-being through strong and healthy connections. So thank you once again, everyone on the call today, for holding this space for us and for holding on as we got ourselves together. And I invite you now to settle in. And as I hand this over to the ladies, once again, I thank you for your time.
Thank you, Rodola. Also, if you could this chat, we realize it's disabled for participants. So if you can just give access to participants, I think we don't have too many people where I think it's nice to see what people are able to share as their questions in the chat.
I will.
And as Rodola said, thank you for your patience with the tech issues this morning. And I'm glad that there's still many people in attendance. And thank you, Angela, for doing this with me today. This webinar actually came from an idea that a parent had where they needed more information on FASD and sexuality. And I felt like it would be good to have someone external to Interwoven to bring more expertise on this topic and new ideas. And I know Angela has been providing support for people with FASD for many, many years, has many resources, which she will talk about at the end. And today we wanted to first talk about, yes, why we need to discuss the topic of healthy sexuality for people with FASD, but also talking about prevention, why some of them are more vulnerable to getting in trouble with the law as it relates to sexuality, maybe more vulnerable to peer pressure, to social media influence, and other factors. And we also want to talk about how it may look like across the lifespan. So we only have a little bit over an hour. We are not going to be able to discuss in details what it looks like across the lifespan, but we will spend more time to talk about childhood and adolescence. And I think you'll have something brief, Angela, on parenting in adulthood. Um, when we decided to bring this topic forward, like we use the term FASD, Fetal Alcohol Spectrum Disorder, but we do include children and youth who have been exposed to alcohol and drugs. And I think this webinar would also apply to anyone who doesn't have a clear diagnosis, but struggles with brain-based disabilities, attachment issues, complex trauma. Basically, the children that we see at Interwoven and that I know Angela sees in her practice. Many webinar often focuses on the issues that we may encounter when it comes to FASD and sexuality. And we wanted to, yes, maybe talk about some of the challenges, but also talk about how individuals with FASD can also have healthy sexuality, that, you know, we want to focus on their well-being, on their safety. And so this webinar is intended to discuss how we can support that healthy aspect of their life. And we will talk about some of the vulnerability aspect as well, but also there's things like it's so broad to talk about sexuality, so we won't get into everything about gender identity, gender fluidity, or these topics. I guess we don't necessarily have time to get into. It will be more of a general presentation. I will also say, Angela will talk more about our approach. Our approaches are very similar. We try to base our approach on the research, but there's very little evidence when it comes to FASD and sex. However, there are certain things that we know for sure. So, for example, we know that prevention is key. When it comes to FASD and sexuality, we know that they might need more education than the average person. They will need more supervision and prevention. I think it's hard for us as caregivers sometimes to teach our kids about healthy sexuality, especially if in your home you're dealing with a lot of chaos and maybe even possibly AFCA, aggression towards family members. Maybe teaching about safe sex is not on your mind, but I think it's important to have this discussion and plan something for our families and also rally supporters. So I will leave it up to you, Angela, to talk a little bit more about our approach.
Okay, well, first I need to start by saying that although it's got a nice ring to it, I'm not Dr. Geddes. So I do not have a PhD. And I've thought about it. Maybe that day will come, but yeah, that's not me. I have an MSW, so, and a ton of years experience. It's rounding 30 now. So I just wanted to be clear about that. And thanks so much for having me here. It's quite an honor to work with you, Dr. Champagne, and the folks at
I
Interwoven.
think you can say both. It's safe to say both.
Yeah. Yeah. So yeah, I mean, I'm really glad to be here. This is a really important conversation to have, and I think that it's a little bit tricky. I often say that sometimes, when we're talking about kids who have been impacted, or adults, or anyone who's been impacted by prenatal alcohol exposure, there sometimes is what we're really, quite aware of the discrepancy or between chronological age and biological age, right? And developmental age. And so there is this dysmaturity that comes with the condition, which then leads to additional challenges. And sometimes we almost don't want to kind of plant that seed or have that conversation too early, because we also know that sometimes that can just be enough to really spark curiosity and almost like a rumination, right? And really to get somebody involved in something that maybe they're not quite ready for. So there's no right or wrong, and I think that the way that we present this presentation is all about what works for the individual and kind of a collaborative approach to harm reduction and prevention. Right. So I think that's, and again, we're going to be talking about the fact that people with FASD, this is a brain-based condition. So this is not behavior necessarily, right? Or a moral setback, or, things like that. So I think we have to understand the research as it pertains to FASD and all of the symptoms that we see, and be proactive, be very explicit, and make sure that there's ongoing conversations around consent and the boundaries and all of that circles around safety and dignity for everyone, right? So I think, and again, when it comes to sexuality, I mean, it's kind of a big word, right? So what we're talking about, again, we have less than we have an hour right now, so we're just gonna hopefully make this really meaningful. But we're talking about our bodies, we're talking about our feelings around sexuality, right? Attraction, affection, intimacy, those things, those desires that we have. We are talking about our identity, although, that's not going to be something that we really focus on today, but that matters in terms of how we see our relationships and our interactions with others. We're going to really focus on our values. And that's where Maud was saying earlier, like, we have very similar kind of approaches, which is why this is an easy peasy, presentation for the two of us to do in that sense, because it does circle around values, and values are different for everyone, but they matter. Because when we don't live in line with our values, there are extra consequences, right, to our view of ourself and our view of the world and our place within it. And so again, our behavior, how we express affection, some people love to be touched, some people love to squeeze and really need that sensory, and sometimes that's not welcome. So it's so nuanced, right? And then again, our responsibilities around consent and safety and protection. So there'll be a lot of that. Mm-hmm.
It's yours, Angela.
Okay, thank you. Yeah, okay. So again, around FASD, there's definitely some different nuances, but the bottom line is, no matter when we have the conversation, sexuality and curiosity are just a part of being human. And they're part of those innate automatic reflexes that we have around procreation, around, keeping life going. It's biological, but it's also survival based. So whether you're 2 or you're 42, sexual activity feels good. It's meant to feel good. So it's going to happen. And now we have to be, prepared to have these conversations without judgment, without discomfort, if it's at all possible, right? So as caregivers, we have to kind of prepare for that, because we do want to make it comfortable, right? And if we're not quite ready, we kind of need to practice, or we need to call on a helper, who
Mhm.
can help you with some of these conversations, right? We don't have to be good at everything and we don't have to be comfortable at everything, but we have to kind of manage that. So, and people with FASD they deserve clear, kind, and protective support. And we as caregivers and helpers of all kinds, again, need to make sure that this is about caring for the individual and caring for ourselves as people with vulnerabilities. These are your values. How can we help you? We're not here to control you or even tell you how you're supposed to think. I had somebody in my office the other day saying, if you're going to try to talk me out of this, I don't want to talk. I said, I'm not trying to talk you out of it. I'm trying to help you make an informed decision. And that's our role with, again, informed choice comes first. So this is, and oftentimes the problems that we see or the risks that we see around FASD is those driven by vulnerabilities and the social context that changes from day to day, from weekend to weekend, not sexual intent all the time, and certainly not always just a moral failure or risk-taking personality.
Mhm.
Okay.
Thank you. And I think it's so important, Angela, to reframe it as I think there's such uh, a negative outlook on their life trajectory sometimes, and the things that they might do that are really wrong, or they might get into that are extremely dangerous. And sometimes that happens. And it seems like we tend to talk about that more instead of talking about how many individuals with FASD end up having a healthy and safe sexuality, right? And or sometimes I think some caregivers are more aware of what's happening in their children's lives when, let's say, they're teens that are maybe a little bit outside the norm because they supervise a lot, which, they should, given their vulnerabilities.
Right.
But then we tend to sort of like overanalyze maybe, or to even give it a diagnosis, get really worried. So I think it's really important to think about what's typical and what might be less typical, and what can we do when it becomes unsafe for the
Yeah.
individuals or people around them. That's when we might get worried.
Yes.
The goal is to prevent, and I would say that it's impossible to prevent all the harm, right? Like, but ideally we would do some prevention. And when you said, I like what you said when you said that maybe we need to practice if we get uncomfortable. But even for the teen, I think most teens talking about this with their parents, caregivers might be a little bit awkward for many teens. So like it's so important to have more adults in their kids' life to have these discussions. So maybe there's other people that they feel more comfortable with. Could be the school nurse, could be an aunt, an uncle, um, friend of the family, right? So I think having, I do NVR, so I'm all about community, but I think it's important to have other people. And there's so much placed on parents too. Think about this, think about
Yeah.
that, medical appointment. And so like we don't want this to be one more thing that
Right.
caregivers have to do, right?
Yeah, for sure.
So I like that you mentioned it. So briefly, and I will talk about them in more details, but I wanted to say a few things about some of these things here. So across the lifespan, when you're thinking of childhood, we're thinking about learning about using the names for body parts, what might be private, what might not be private, teaching about boundaries too, like when do you touch someone, when you're not touching them. And for typical children, I would say that with modeling, it seems like it's integrated fairly rapidly, fairly well. But for someone who has a brain-based disability, very often you need to practice. You need to name those gray zones and go over social stories. They may, and I'll give you some examples of exercise you can do either as a therapist or support person or even as a parent. One thing you need to think about is the difficulty with generalizing concept. So if I have FASD and I learn something in my therapist's office, quite possibly I'll be on the bus and not think about what I learned in my therapist's office. So it's nice to try to be aligned in what we're teaching with the school, with the therapists, with the parents, other people in their circle of support. Also helping kids identify who's a safe person, who may not be as a safe person, trying to see the red flags. Sometimes it's really important. Who can you go to if you feel uncomfortable? How do you say it? So these things need to be practiced when our children are younger, and it's a good start to start teaching about hygiene. Hygiene problems can also be supported by occupational therapists. Sometimes, you may want to have the help of an occupational therapist um, to start having those discussions about, how do we stay clean? And even some of them, some therapists and occupational therapists are trained or have expertise in teaching about even masturbation, what it is, how to do it. And I think some parents may feel like, oh, how to teach them how to masturbate, that like most parents don't want to have these conversations, to be honest, but most kids will do it anyway, but might use things in the household that are not appropriate. So you would likely, maybe you like it better if they use appropriate things, not like someone else's pillow, someone else's stuffy, or the shoes of, your guest, or, to be very blunt. So like talking about these things, and being curious about it, right? Like not getting into the shaming the child, but having open discussions. And if you feel very uncomfortable, having a supporter to have these discussions with your child. In adolescence, this is when, oh, and I also want to point out that in childhood, I'll talk about it later, actually, early puberty. But in adolescence, this is when they may be more inclined to peer pressure, as most teens, except people with FASD, they bring it to another level, right? The issues that you can have. Belonging, this is when they might get curious about their sexual, identity, their gender identity, who they are attracted to. And this is when it could get stressful, I think, for parents when these children are starting to do this exploration. And Angela, you'll talk about that more. One thing I think is important in adolescence is, giving as much education as possible. Same with childhood, and the support, having supporters around us to help us do that. So it's just like an oversight of what that could look like. We won't talk much about adulthood. However, I would say that the main message that I usually have any issue with kids with FASD is, hopefully parents don't see themselves as the only source of support for their kids. And that comes to healthy sexuality as well. So when you get to adulthood, you want to make sure that your child knows how to go to other people if there's an issue, so they can have healthy and safe sexuality. And you can also start off long-term planning and not just like trying to extend fire here and there. Oh no, I'm going to talk about childhood, and then it's your turn, Angela. Sorry.
No, that's okay.
There's an exercise that I wanted to share, and it was shared in another webinar because I shared it with the person who was teaching. So, and you may have heard about it, but I try to make it as concrete as possible when I teach a concept to someone with FASD. Like just giving rules like that or ideas, it's very abstract. So whenever you can make it visual, make it visual. We also know that they might be rigid in their thinking. So we used to say black and white. I'm more like, okay, like thinking about the gray zone, or I use like red, it's a no. Green is yes, and yellow is like, maybe not so much. So I use that. And what you could do is, for example, draw their bodies on a piece of paper and have little papers of like red and green and yellow. So I would say things like, okay, if you see me at Walmart, we know each other from my office. Can you touch me? Can you give me a hug? Okay, so, and then you start this discussion. Can you touch my head whenever you see me? And then, so they might be like, no, I cannot touch your head, right? So I would put like a piece of paper that is red, what about your mom? Is it okay to touch her shoulder? Yes, likely so. The shoulder is usually safe. What about, and then you get into these situations that are maybe more simple, and then the situations that are more complex, and having this discussion. And so they can even bring this exercise, do that at home, and then do it maybe at the school. So you can have like little cards with social situation. Because I feel like I don't know for you, Angela, but we try to be rigid about some of these rules, and it hasn't worked out. Like, for example, the bikini thing, I heard before, like we used to say everything that's under the bikini, don't touch it. So I heard this story, this kid with FASD was on the bus, and he saw this girl that was really pretty, and he touched her leg. He's like, it's not under the bikini, but it's still very inappropriate, right?
Right, right.
So like I try now to be not rigid in my thinking, but also thinking, okay, what might happen in real life, and keep
Mhm.
practicing it. It won't solve every issue, but at
Mhm.
least you might be preventing certain things.
Yeah. And in my office, I kind of address it too around, just that whole personal space and your own bubble, what most people are comfortable with. And so, we do the round the circle, and this is my space. And in order to get in it, you often, it's nice, it's a nice thing to do to ask permission. Can I come closer? Or so just sort of getting into the habit of, but I think that then the extra nuances around impulsivity and just seeing something and wanting to touch it. Like if I have a necklace on, it's like, oh, and so there's those kinds of things that sort of take over, right? That are not intentional, that we just need to be mindful of. But again, I feel like the more we talk about these extra complexities and the symptoms that individuals experience, the easier it is for them to say, that's the way my brain works, and I need a little extra guidance in this area, right? And
Exactly.
and
Yeah.
then if they do jump into somebody's personal space bubble, when reminded, they're able to say, whoops, sorry about that, I got carried away, and then laugh at themselves rather than make them feel really awful or feel shameful. So I think if we have a sense of humor, but yet also those clear kind of rules, it's just helps people in the best position possible, right?
Yes, I like that. That's good. Like, even how do you recover
Yes.
when something like that happened, right? Like making
Right.
amends, which might not be easy. I do use a lot of stories. I don't know if you use that in your office, Angela, but sometimes when they're younger, I use even stories about animals to
Mm-hmm.
make it concrete. And
Yeah.
especially if, sometimes parents come to us when after something happened.
Right.
So like you're not working necessarily from prevention. There's already a shame attached to it.
Mm-hmm.
Um, so I might use a story and explain, okay, this little animal really wanted to touch the other animal, and that was really hard. The hair looked so soft, right? Something
Mm-hmm.
like that. And then after they might be like, I think you're talking about what happened with,
Right.
you know,
Yeah. Yeah.
John or whatever. And you're like, yeah, that's what I was talking about. Let's talk about this. How can you recover from that next time or prevent it? And
Right.
so using stories, I feel like it's also a good way to have this discussion in a way that's concrete and not shameful. Um, Again, rallying supporters, I cannot stress it enough, as many people as possible who can have discussions on not just sexuality, but that involves too, like relationship. What if you're attracted to someone? How do you tell them? How do you accept no for an answer? Not just like for sexual touch, but like also for, I don't really want to receive pictures from you. I don't really want to talk anymore. Like, how do you respond to that kind of rejection, which can be very difficult to navigate? Um, the last thing I'm going to mention about childhood is the possibility of early puberty. So we know that people with FASD are more inclined to have early puberty or late puberty. I've seen more, I don't know for you, Angela, but I've seen more kids with early puberty and the issues that it can bring. Like they are hormones, but they don't have the maturity to deal with them, to deal with being attracted to someone, dealing with periods. And what I found is giving enough information to the young person, and usually things that might be not developmentally appropriate, they won't understand it anyway. So sometimes I give a little bit more than that I think they're ready for. And just usually we need a doctor to be involved when there's early puberty. So, they might have to monitor their hormones, their growth, and also how that might be affecting their mood. I don't know if there's something else you want to.
Well, I mean, that's just an interesting, indication with medications as well, right? So the mood and the, I mean, I think we often see aggressive behavior, or maybe just more intense emotions as the gap widens, right, developmentally. So when there's more responsibility and we're experiencing more challenges and things are a little bit harder socially, so there's that plus this, and then you're really really young and all of a sudden you have to navigate your period, and the teasing and the things that just happen at school as well, right? So there's just a whole bunch of things that can compound that. But again, having conversations that make sense to the individual without planting too many unnecessary seeds or worries as well. Taking some of that on, I think, as caregivers can be really helpful as well. Not that we need another thing on our list, but sometimes we do need to protect our kids from things that are conceptually hard to navigate. Right. So yeah, so again, to kind of go back to our understanding here. I mean, a lot of the way that we what gets tricky around what I see around people who have been affected by prenatal alcohol or other substance exposures, or who have brain-based conditions, is oftentimes their behavior does not line up with who they think they are as a person, or their values, right? Their character and their hopes and dreams for themselves and for other people. So we see that often when kids, yell at their parents, or, just forget their homework for the 18th time, right? I mean, when you constantly are making these kind of boo-boos, but yet school is really important, but yet I keep sleeping in, so how is school really important to me, or is it not really important to me? I mean, these are fundamental challenges that people with these kinds of complexities live with on the daily, right? And when we're not living in line with our values, I often use this example. If I'm not in the greatest mood and I hurt somebody's feelings by the way that I've discussed something or said something, that will bother me more than if somebody hurt my feelings, because I believe that I'm a respectful person and I value respectful communication. So when somebody is, again, behaving in ways that are not lining up, that is anxiety, that is angst, that is a view of self that's compromised. So again, it's not for us or me to decide what your values are, but I think most of us want, in terms of sexuality, we want safety. In terms of relationships, we need to feel like we belong, like we have meaningful relationships, that we're important to other people. We need to have good health and mental health. We need to, feel respected and offer it. And, having healthy relationships, I think, is something that we all want, but yet it looks very different for people. Right. And this is what I continue to learn, and I'm honored to do so by walking alongside so many people over the years. Right. But this was really kind of game changing for me in terms of relationships, and that, I'm working with somebody who has, many people who have FASD, and they also partner with somebody who has complexities, probably not diagnosed, but quite likely, right, in line with prenatal health and things like that. And so then, we're protecting the individual with FASD by saying, these are healthy dynamics, being yelled at, aggressive expression of anger is not okay. That maybe this is a domestic situation that needs to be like, we need to end this relationship. And of course, physical safety is paramount, and I'm here to support that. But the people with FASD are teaching me things like, hey, people give me grace because I explode sometimes and I don't mean to. I say things that are hurtful, and I do not want to do that to the people that I love. So why would I judge the person I love by having a meltdown? That's not who he is. That was a behavior. That was an incident. That was a dysregulation, right? So this is like, to me, this is the kind of compassion that the world needs more of. But yet, how do you balance that to make sure that people are in fact feeling safe? But I always say my normal is not your normal in quotes, right? Like there's variances of normal. And so we can impose our normal on other people, but yet we have to recognize that vulnerability and dance with people in a way that, that flows and makes sense. So, but again, the more people realize what or understand their own symptoms, they can say, I'm most vulnerable when I'm really emotional. And I haven't had the luck yet, but if or when I win the lottery, I'm unlikely to make a decision for at least 2 weeks because I will be flying high, right? And so I won't be able to think straight. And the same goes when I'm really down and sad, right? So big emotions, strong pulls of attraction, pressure to belong. And again, people with FASD or some sort of complexity sometimes miss cues, but then also want to make people feel good and want to make people happy and want to make people want to be with them. So if somebody suggests a sexual act or, connection that might have not been on their agenda, they might be more prone to do this in the sense of this is my contribution to the relationship. So conversations around boundaries and that kind of thing needs to happen. And of course, when we're tired, which most people with FASD that I know of anyways, have kind of inconsistent sleep patterns, right? So that can be an extra vulnerability, and certainly substance use. So these safety rules that protect our bodies and our well-being kind of need to be made way ahead of time. And then how do we implement them? Who do we need? What do we need to remind us? What do we need to make sure that we follow the rules that we've created, right? So, and again, these values are different for everybody. I have people who, are a little bit more, everybody's different. So the rules around and your moral guidebooks and your ethical choices are yours to make. Some I work with who choose, I don't want to be intimate until I'm in love. Help me to determine what love is and what safety in this relationship is. I don't want to have intimacy until I'm married. So this is what I'm going to do. So that means when I go to parties, I don't go into rooms alone with people. I bring a friend with me to a party who helps me to remember the rules that I've made for myself, right? So again, as you said, we can't prevent everything, but we can put people in a good position. So again, sexuality is yet another vulnerability because we know impulsivity is a problem, and impulses move faster than the way we think and the way we problem solve. So even when Maud was talking about masturbation in different ways, I think sometimes we're more aware of the things that people with FASD are doing because they don't often problem solve in the same way around, hiding things or figuring out ways that are going to be less intrusive to family or our environment. But again, the pressure to connect is really, really strong, especially for people who have had challenges socially. And many of the people we work with do, right? We know that there's a challenge between seeing cause and effect and looking at long-term consequences. So if we're looking at connection and relationships, we might not be able to see that, whoops, this could result in an unplanned pregnancy, or it could result in me feeling sorry tomorrow. So again, without rules, people rely on how they're feeling, whether it's physically, mentally, and all of those things that we've talked about. So it's not because people don't care, it's because our brains sometimes are overloaded and we're just uncertain. So
Is this mine or yours?
I think you can take it and I can jump in.
I'm like, okay, this one. Oh, I tried to be organized. Okay.
Yeah.
Okay, so to just continue what Angela was talking about. I think the main message is, parents are worried that their kids may, I don't want to say lack moral values, but like, yeah, that this isn't like they don't follow rules, they don't understand them. Um, but very often, I think we have to be very curious about why certain things happen. Um, I've seen a lot of young teens where they are just bored and they end up masturbating 10 times a day. Okay. And that's a problem because they get irritated and family members walk on them all the time. And so whenever there's some kind of issue, I try to be curious about, okay, is it boredom? Is it sensory? Is it the emotional regulation that's difficult? So whenever they feel anxious, that's the only go-to is masturbation or having sex with someone. So I think staying curious in that sense of like brainstorming with the young person, what's in the way, what's actually happening here for you. And maybe as a parent you don't really want to do that, so you need a support person. And when you talk about rules, I mean, we had the conversation, Angela and I, where I know that many of my clients don't like the word rules. They might want to use guidelines or
Standards.
yeah, that too.
Yeah.
Like finding a word that works for them, because it's not about the rules that we impose. It's about how they want to live based on their values, right? And when it gets when we're thinking about the harm on someone else or themselves, that's yes, maybe we want rules in our home, but we also want guidelines based on values and a plan of action. So again, with my approach in NVR, we usually try to avoid just extending fire. What we want is to have a plan of action in place that will not prevent everything, but that will prevent certain harm. Um, Something else, reflection often comes after, not before action. Again, this is when we need to plan. And then if something happens, then sitting down and brainstorming about what can we do next time. So I'll give you a very specific example. This young man, when he turned 18, and that's very common. Um, when they turn 18, they think there's no more rules and they can just do whatever they want. Well, I'm an adult now. And I think part of it is like us, well, when you're 18, you're an adult, you need to do this and that, or this, you're responsible now, right? But they don't necessarily have the developmental age to make these kind of difficult decisions, and they're still quite impulsive for many of them. So talking more in terms of, okay, at 18 comes with more responsibility and consequences from society, right? And having these discussions that you still need rules. We still have rules and guidelines that guides our behavior. We still need support. And the more we normalize receiving support, even when we become adult, the better it will be in terms of preventing some of these difficulties. Also, normalizing receiving help from others and having discussions on like, look, I have problems with this and that. Who can help me? Who can I go to? So to go back to the young man I was talking about, he was gay and he was, having sex with much older man, which was really worrisome for his parents and somewhat outside their values, but he was going to do it anyway as a young adult, right? So we needed to think of, okay, what can we do? Like, this is something he will continue to do no matter what. We cannot, dictate him in the house. So they decided to have a strong plan of teaching him about the risk of engaging with people he didn't know much, multiple people. So he had a doctor he could go to. He knew where the clinic was. He knew what to look for in terms of like signs of infection. He had access to condoms. Like there was so many things in place to prevent further harm, but we could not prevent everything, right? And he had the plan on his phone and he had it in writing in his room. So that way, at least we had some sort of a safety net for what could happen. Um, there's a bit of I talk about that later, but I think maybe I'll talk about it now. There's something that I think is confusing sometimes for us as caregivers is the difference between secrecy and privacy. Um, so when as you all know, like our kids are allowed confidentiality in therapist office, doctor's office. The problem is sometimes we know that there's something that might be harmful to them. And even as therapists, if someone tells me something and I am concerned for their safety or the safety of someone else, I am allowed to break confidentiality. That's a bit tricky sometimes, but anytime you're thinking, well, I want to preserve my child's privacy, so I'm not going to tell the nurse at school, or I'm not going to tell my spouse, or I'm not going to tell their therapist, and vice versa. It's really important that our kids, yes, they know it's safe to come to us, but they also know that we don't keep secrets that are harmful to them. Privacy can be broken whenever we are concerned for someone's safety. So this is how personally I assess if it's secrecy or privacy. Secrecy, it's usually when it's harmful and we keep it a secret. While privacy is like, doesn't belong to everybody to know. Does that make sense, Angela? I don't know how you.
Yeah, no, I think that's really, really important. And I know, even in my practice as well, like I really open it up like we are a team, including whoever you need to be at your circle. Like lots of times it's caregivers and parents, and but I make sure that I do create that safe therapeutic space, and moms need to have that safety for their children as well. But sometimes dads need to know if there's extra supervision or extra guidance that needs to take place. So again, it's that, how do we preserve that safety and dignity, but yet safety is paramount, right? And that's what it has to be. And that's what I say with in my room too, that if there is something that I think parents need to know in order to keep you safe, then we'll check with you and we'll figure out a way to share that as a group and problem solve together, because none of us can do this alone, in my humble view, right? This is we do better with teams, right?
Yeah.
Yeah, for sure. Yeah. So yeah, I mean, I do use the word rules a lot. And I think that, again, when I'm talking to people, it's not my rules. It's the people that I'm working with that help create these, right? But I use them because it's a concrete word. And I don't think that there is much room for gray when it comes to consent, for example. And there is a ton of gray, right? When we talk about consent, that's a big deal, because if you've had intimate relationships with who you think is your partner, then the next time you're probably thinking that that's going to be an okay thing to do, right? But what if the relationship broke down? And then sometimes people don't understand, like, we've made a commitment, so even though we have an explosion, that doesn't really matter, we're still together. But the other person may not understand that in the same way. I think many caregivers understand that, oh my gosh, we just had the biggest fight, or, whatever happened in my house. And then he comes up 20 minutes later and says, hey, mom, can I grab you a coffee? And you're still like steaming out the ears, right? And so madly in love with this person, but also so madly upset, right? So there's just, but that kind of thing happens in relationships too. We have, best friends that are no longer best friends, but they still are from the person's point of view. Like, just because we had a fight, that doesn't mean anything. We'll make up. Those things don't always happen in the same way, so we have to do those double checks. So that's why consent every time, those things are important. And remembering that our brain has some vulnerabilities, so I cannot rely on memory alone. I have to rely on a friend. I have to rely on checking my notes section. I'm going to a party. I'm going to a concert. I'm going out on my first date. What is my rule around dating? Have I decided that it's at least 3 dates before I go home alone with somebody? And again, those are for you to decide, or for the individuals. But have you decided? Have you thought about that? Right? And relying on memory when your memory doesn't work as well as you would like is setting yourself up for trouble. And how do I protect my heart and my boundaries, right? Those are rules that again help you and the people that you love, to create these boundaries that make sense. And that's why protection every single time. No decisions when we're upset or when we're elated or when we're overly excited about things. And again, we've talked about that, who can help me remember my rules? And it helps because sometimes we have decision fatigue. Sometimes people tell me that their mind just kind of goes blank when they're overstimulated, when their body's on fire, when their brain's been busy, and when they're feeling something so intensely, their ability to think through things is a bit compromised. So decisions that are made prior to are easier to follow when we're aware of them. Yeah, so I think that's why rules or guidelines or standards or whatever it is, whatever term you want to use, that's why they're helpful. And I think that throughout these conversations, it's imperative that we remind them. Age too, social media, who you're connecting to and what are some of the risks around that. Those are huge, right? And my goodness, like what a vulnerability we have when we're connecting with people who are telling us they're older than they are. People who, like, child pornography is child pornography. Even if you're distributing a picture of yourself at 14, that's child pornography on your phone, even if it's you, right? So then you send it to somebody else who's overage, then there's a criminal activity going on and you weren't aware of that, right? So those conversations, even though again, we don't want to plant seeds too early that are hard to understand, but we do have to have conversations around who checks your phone regularly to make sure that your conversations are healthy and respectful. And what kind of pictures do we send? And that conversation can start really, really early. And very clear rules and boundaries around that are imperative, I think. And yeah, I was saying social media is one thing, but I had a thought. It'll come back to me. But yeah, there's just lots of things that we need to consider. But I was going to give the example of where, again, the dysmaturity and the developmental age sometimes doesn't line up. And so there was a situation where I was working with a young family, and this gentleman happened to be in his early 30s, but he was kind of friends with a bunch of teenagers, and they would hang out at the Tim Hortons and downtown and different places, and they'd go places, and they were getting along quite nicely until, and I don't have to get into any details, but there was some physical attraction and things that started to evolve and develop that then suddenly became problematic, after this long-term relationship. And for the longest time, this fella just didn't see what was wrong. And, there was an innocence about him that, for all intents and purposes, it wasn't wrong. It was just wrong. Does that make sense?
Yeah.
You can't be with somebody who's 13. So you need to know that rule. It doesn't matter. There's places you don't go. Right. And that goes back to your values and to societal values, because just good intentions does not erase consequence. And we need to help people understand that as well. We owe that to people, right?
Something that I'm thinking now, I think this section is more about teenagers, or even young adults, because when they're children, we make the rules as parents,
Right.
like
Right.
who you can hang out with, who you can invite over, do you have sleepovers, do you not have sleepovers? And then as they get a little bit older, we start doing collaborative decisions making. What are your values? What would you like? And it looks different for every family, right?
Absolutely.
And I think it's the difference too between what's a rule that is value-based, what is actually society, right? And I think your example is like, well, it's the law.
Yeah.
Like there's a law around consent that is kind of hard to understand for many of our kids, right? Like now we even say for consent, the other person need to be enthusiastic. What does that mean? Like concretely.
Yeah.
So I think it's like, yeah, like recognizing what are some of my rules more like in terms of like practical stuff, and what does the law say? What does the law say about safe
Yeah.
sex and
Yeah.
age and
Yeah.
consent?
Yeah. But
Some,
things like you said, foundationally, when kids are little, privacy around, self-touch or self-pleasure, right? Privacy, cleanliness, all those things that if you start when they're really little, because let's face it, sometimes this happens when people are really little, right? Then it's kind of easier to carry on.
I'm looking at the comments too. So someone talked about what if your child was sexually assaulted? Another one said it's easier to control, the child when they're younger. True. Like it's much easier to provide supervision on a young child, a school age child, when they're than if they're teens. Um, and I think a lot of parents who are raising kids and youth with FASD are being accused of being helicopter parents and like, you know, providing too much supervision. But I think it's important to actually encourage parents to provide that kind of supervision, and to have support in that. So it doesn't all fall on them. Like who else can support and understand risk? I think some schools are great, but some staff may not understand the risk that our children with these vulnerabilities are facing. So sometimes it comes with education around their vulnerabilities.
Mm-hmm.
And yeah, there's many things. I mean, in my own home, we have used like phone without camera, so they cannot send pictures. There's apps. There's one called My Pack. If you look it up, so you can block tons of content on your child's phone. You can see their messages. You can even have like tags. Let's say your son is pretty much harassing Melissa in, the art class on like online, and you do like you blog Melissa, or you have some sort of like hashtag, can't remember what it's called. Anytime there's like a Melissa coming up in the thread, you will find out. So, it may seem extreme, but that's the only way to prevent certain things. But comes a time where you can only rely on the education you provided before and ask other people around to be that source of support, especially when they get older. Anything, not just, I feel like not just with sex, but even what they do with their pocket money, if they're getting a job, how they behave in school, if they're using drugs and alcohol. I think we don't have control over it, right? Like we can only do some kind of damage control by rallying other supporters.
Yeah. I'm looking in the chat too, and there's lots of really, really important discussions to have. The risks around public washrooms and people being mistreated. I mean, those are so hard to prevent entirely, right? You can't anticipate when when these things are going to happen, but having people close by or having social stories and having conversations around what happens when, that and then having some kind of trauma approach therapy through an FASD informed therapist too would be really helpful around how to kind of reconcile some of those traumas and those challenges. I think there's a question here around birth control too, and again, it's kind of creating rules, and I think sometimes birth control before you need it is sometimes really helpful, right? Even if it's something that some people struggle with. Are we giving permission for sexual activity at such a young age? But I think sometimes we're preventing something from happening that probably should be avoided, right? But yeah, there's all kinds of things to consider for sure. Yeah, and harm reduction is important. But I think it's the only way we can go. You've mentioned a couple of times, we can't prevent everything. People are going to be having sex. People are going to be exposed to drugs and alcohol and social media and interactions that are less than ideal. And as a parent, I don't know if there's anything more heartbreaking, right?
Especially now with social media, it's hard to keep up with what's happening, right?
Oh,
In the online world.
yeah, yeah, for sure. Yes, I'm just realizing that we're running out of time, so we should probably move
Yes.
along.
Okay. Maybe that's the last slide, and then we're gonna talk about resources.
Okay. Oh, is it? Okay, good.
Okay.
Yeah.
Well, there's another one that's like parenting stance, and I think we've repeated
Yeah.
stance. We need to take for
Perfect.
an
Yeah.
hour now. So NVR, I do nonviolent resistance. That's one of my main approach now.
Mhm.
And there's something called an NVR campaign of concern. And it's not to be done at any moment. It's when you think their safety is at risk. Okay, if you think, like you gave the example of the 13-year-old who was in a relationship with a 30-year-old person. Okay,
Yeah.
so that's a good example. So what can you do? So the idea of the campaign of concern, I have the picture here. So it's basically like um how to put pressure. You cannot control the other person, but put pressure, I guess, as a group, as a community. So if you're 13-year-old, you think they're engaging with someone who's much, much older, it's not appropriate. And the parents just say you cannot do that. Very likely your 13-year-old would say you're so old-fashioned, you don't understand, you know, things like that. They don't necessarily think it's out of love and concern. So the supporters in this case could be an aunt, uncle, school nurse, EA, other people who have a relationship with your child or your teen. They will reinforce the parent voice. They would say, look, this isn't just your parents. This is a rule that is in society. And you don't do that in a way like that's like a right? It's like it's collaborative, it's out of love and concern, and you consort your efforts. And it doesn't mean that you're not going to ask a school nurse to provide contraception, right? You might, I mean, if they are going to do it, they're going to do it anyway. So you want to maybe prevent the harm by, okay, let's go for contraception. The school nurse can have these discussions with you. And really, the campaign of concern may not prevent everything, but the goal is always to improve the well being of all family members. What if your teen starts bringing strangers in the home? How can supporter help you? So you don't have to have strangers in your home. You also can have rules in your home if your child's being, crossing these boundaries. So this is what we call a campaign of concern. And yes, I think Marissa says, I wish I started earlier. I think we all feel like as parents that we start earlier to prevent certain things. Um, but I think in my experience, most caregivers, we get so carried away with like medical appointments, difficult behaviors, and it's like prevention is not even on our radar. But sometimes it's like, okay, I need to go back to this. Okay, what can I do and have a plan in place to prevent some of these things? Because it is possible. I don't want to this, people to come from this presentation thinking, okay, so many bad things can happen. There's also a lot of good things that can happen, right? Like there's so many adults with FASD who have a healthy sexuality and healthy relationship. It's just considering that they will need more support. And same with finances, same with schooling. Oh, we don't have time now.
I was just going to say too, that it's really important to note too that, things that might be shocking or uncomfortable for us might not be as shocking or uncomfortable for other people. And people with FASD tend to bounce back from things quicker. I often say it's a bit of a strength and a bit of an Achilles heel in the sense that, people with FASD tend to be very in the moment, right? And very reactive or in the moment, or very like I'm here right now and I'm feeling like very angry. I'm going to have this reaction, but then it's over a few minutes later and I'm on to something else. So that's amazing, right? That's really great. But that also makes it difficult to link that cause and effect and to bring transfer learning from one scenario to another. So I think those are things that are important to remember. But also, if they made a mistake and had sex before they were ready with somebody and maybe that didn't turn out that well, they might not be too bothered by that 2 or 3 days later, right? They may be able to move on in ways that so it's important not to pathologize things that are not necessarily bothersome, right? To project our discomfort onto others. I hope that makes sense. Yeah. And I think just briefly too around gender and sexuality, again, this is a whole other presentation, but I think that, you know, I work under the premise of, you know, accepting the circumstances for what they are right now and taking some time to breathe, being very curious about what's driving some of the confusion and what we need to do to be less confused, for example, or less, you know, uncomfortable. Think about dysmaturity, think about suggestibility, think about how some of our kids tend to ruminate and then really need something with a level of urgency today, and a week later that might be different, right? So I think that these kinds of things are okay, right? And just accept some of this curiosity in these conversations without shame and without any judgment. Just helping people make decisions based on how their brain works, right? And sometimes we need a little more time. So, yeah.
And again, well, and we'll send the PowerPoint to other people, but I think we said it the whole time, right? The importance of rallying supporters, avoiding the shame in the child, validate their feelings and being curious with them about why they would be more inclined to be attracted to certain things or have certain behaviors, and normalizing receiving support for their sexual health beyond their parents.
Right.
So, okay, we don't have time for this, but I think let's talk about some of the resources.
Yeah, I know somebody had asked for some kind of plans, you know, plan of cares through some of these different conversations. And I don't know, it might be kind of an opportunity for a shameless plug for my latest resource, which is not your typical, not your typical growing up and adulting guide, where it certainly talks about some of these vulnerabilities that people experience in terms of relationships and intimacy, and creating some sort of rules around that. There is also a companion workbook that is meant to be read. The book is meant to be read by the individual, but maybe with a parent or caregiver, so that there can be conversations around that. Some will apply, some will not. You don't have to read it start to finish. And again, there's a companion book that goes with it that's meant to be, there's a section for caregivers or partners or helpers, so that, you know, what does this dysregulation look like? What does this emotion look like? How can I support it? So from the person's perspective and from the individual caregiver. So
it's the one on the right, the green one.
Yes, the green one. And then, like I said, there's a companion workbook with some plans in it. So it's my shameless plug. Sorry, but not sorry.
No, it's okay. I think it's important to talk about the resources. I mean, I have a book too, and it's not like we're gonna make a fortune out of it. It's really out there to help people and like provide people with the knowledge that we've gained through our best efforts. Helping caregivers. No. Like even as therapists, we don't have all the answers. There's like age situation is unique, challenging, and we need to, like you said it at some point, like we need to collaborate with between the individual who has FASD, who may have a different perspective than the caregiver versus the teacher and versus the therapist. And from one thing we know from research is if you do that, you will prevent a lot of bad things from happening. It needs to be collaborative as much as possible. Maybe less when they're very young, but the more they are maturing, we need that.
Absolutely.
Sorry, sometimes slides move without me touching anything.
Yeah.
By the way.
It's magic.
While we're on resources, Maud and Angela, there is a question around resources for great visuals for explaining sexuality or making safety charts or rules and expectations around boundaries. So would you have anything that you might recommend for visuals that might help?
I have kids' books that I used to use, and I will send them to you, Rodola. So when marketing sends the PowerPoint, they could be sent. But they're more like kids' books around consent and around body parts. And I don't know, for you, Angela, I mean, you do have your book that talks about.
Yeah, well, this one here has like written, like there's a lot of space for consent ladders, for example, the 1, 2, 3, you know, kind of I spoke a little bit about, when do you think it's okay to go home alone with somebody, making those rules. Those are all kind of in here to be customized for the individual. But I didn't, and these books are not just FASD specific, because we know so many people are not diagnosed. So it's hard to give somebody, especially an adult, who may be experiencing some of the impacts of prenatal exposure, but doesn't have a diagnosis. It's hard to give an FASD specific resource, right? So that's why this is open to complex symptoms. But I don't know of any other. That's kind of why I wrote it, because I didn't see. Yeah, then that's what, when I keep having the same conversation in my office a few times, then I decide that I got to create a resource, and that's what we do. So
thank you very much. It looks like many people are interested in the resources.
Yeah.
Do you want Rodola to discuss some of the interwoven resources that we have?
Yeah.
Sure. So as many folks in our community and on the call are aware, we do have our interwoven peer connectors across the provinces, but we do have some on-demand resources available through our website at interwovenconnections.ca. And these webinars, our meetings and events are also available. You can find them in various tabs. There's an events tab as well, where we are meeting also in person. And perhaps for some folks, this was great, that they'd like to see somebody right in front of them and talk to them. So there are lots of ways that we can provide that support. And also through our YouTube channel at Interwoven, youtube.com at our Interwoven Connections channel, and our Facebook pages as well. So there are many ways to access the supports that we do provide. And a more direct way would be to connect with your local and regional peer, your regional peer connector. That would be someone that might be available to you right away, and our resource library. It's quite fulsome as well. I did also manage to get onto our other websites that are available to us, and some of the resources that are available here around FASD. And this can also be, as the recording is being made available, you will have this to look at again for reference in future.
And just before we go, I think it's important to note too that our little agency is growing. We're just a small but passionate team, but we do have members that are growing across the province, and I actively participate in delivering training specifically for social workers, therapists, and allied health professionals to better screen and assess and deliver services that are more relevant. So the next round is happening in May. So that's, just wanted to share that as well, that we're trying to build capacity so that more of us can have these kinds of tough conversations with the people in your circle, right? Yeah.
Thank you. Well, thank you everyone for holding the space for us. I'm sure people have lots of questions, but please feel welcome to reach out to either of our wonderful panelists today. And you can do that through interwovenconnections.ca, through your peer connectors, or directly with our panelists for today. We do thank you for holding this space and apologize for the technical difficulties at the beginning. And we hope to see you again soon at our upcoming webinars. Thank you very much.
Thank you very much. Thank you.